Hello again. Welcome to yet another episode on hypertension. In this episode, we will learn about complications of hypertension during pregnancy. We will see what are the different forms of hypertension during pregnancy, what are the hypertension complications during pregnancy, and we will also see who is at risk of developing hypertension during pregnancy. So let's jump right into it. Let's start with looking at different types of hypertension during pregnancy. There are several types of hypertension during pregnancy. These types vary in severity and impact on the body. These different forms are preeclampsia. It is a condition that occurs when hypertension develops after 20 weeks of pregnancy and is associated with signs of damage to other organ systems, including the kidneys, liver, blood, or brain. Untreated preeclampsia can lead to serious, even fatal complications for mother and baby. Chronic hypertension. It is a high blood pressure condition that was present before pregnancy or occurred before 20 weeks of pregnancy. Because there are usually no symptoms of high blood pressure, it might be hard to determine when it started. Gestational hypertension. This condition occurs when a blood pressure condition is developed after 20 weeks of pregnancy. Women with gestational hypertension don't have signs of other organ damage and there is no presence of excess protein in their urine. However, some women may eventually develop preeclampsia. Chronic hypertension with superimposed preeclampsia. This condition occurs when a woman with chronic hypertension starts to develop worsening high blood pressure and has protein in their urine. Hypertension during pregnancy can cause various complications for both mother and baby. So let's see what are these complications. These complications include decreased blood flow to the placenta. The placenta is an organ that provides oxygen and nutrients to your baby, and decreased blood flow to the placenta will cause a limited supply of oxygen and nutrients to the baby. Second, placental abruption. This is a condition where the placenta gets separated from the inner wall of the uterus. Severe abruption may lead to heavy bleeding and also can be life-threatening for you and your baby. Third, intrauterine growth restriction. Hypertension also results in slowed or decreased growth of the baby in the womb. Fourth, premature delivery. At times, an early delivery might be needed to avoid life-threatening complications. Those were some of the complications. Now let's see who is at risk of developing hypertension during pregnancy. The chances of any woman developing hypertension during pregnancy are high if she has had gestational hypertension during past pregnancies, is expecting multiple babies, has gestational diabetes, has a family history of gestational hypertension, is overweight, and has immune system disorder. That was all about complications caused by hypertension during pregnancy. To learn about the management of hypertension, stay tuned with ArogyaDrishti. ArogyaDrishti provides you an easy and convenient way to organize, access, and share your medical reports at your fingertips.